All attendees are in listen-only mode.
Good afternoon, everyone. Today is Friday, March 25th. I am Donna Will, Professional Development Coordinator for the Maryland Developmental Disabilities Administration. We welcome you to the monthly series of DDA updates with Deputy Secretary Bernie Simons. On the panel today, we have Bernie Simons. We also have Robert White, Director of Administrative Services, Rhonda Workman, Director of Federal Programs, Patricia Sestoki, Director of Programs, Carrie Zanchi, Office of Change Management, Tanya Ferguson, Chief of Staff. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, and that's by computer and phone. And if you look at the panel interface on your right, labeled audio, you can click either computer or phone to switch for the best option. There is one handout, no, there's two handouts for today's webinar, which can be loaded from the handout section. And if you're listening by phone, you can request that they be emailed. We are recording the webinar and posting them on the DDA website and YouTube. Questions can be typed in the question or chat box in the webinar panel, and we'll get to those towards the end of the presentation. So now I'd like to introduce Deputy Secretary Bernie Simons. Good afternoon.
Good afternoon, and I want to thank everybody for setting aside this time on this Friday to attend our monthly webinar series. If you were counting, you'd say, well, how many of these have we done? And we've done actually 45 webinars during the full 2 years since we started with the response to the COVID pandemic. And at everybody's request that we've heard from, we're planning to continue these monthly webinars, but we broadened our agenda to engage with you around both DD updates as well as the COVID response. I'd like to recognize and celebrate Developmental Disability Awareness Month and the wonderful contribution each and every one of you make, not just during the month of March, but throughout the whole year for the people you provide supports to and their families. And today we're going to provide you with some updates as noted in the agenda. So again, thank you for partnering with DDA and help guide services, plans, resources to make a positive change for individuals with IDD, their families, direct support professionals, your peer providers, as well as others. And I thank you for all of your feedback and questions. So if we could go to the next slide. So here you'll see we've broken this into sections. This is the first section, and you can see the areas we're going to cover. So next slide. So to commemorate Developmental Disabilities Awareness Month, our Governor Larry Hogan signed a proclamation declaring March 2022 as DD Awareness Month in the state of Maryland. Renews our resolve to work towards the promise of a Maryland in which all people with intellectual and developmental disabilities have the knowledge, the opportunity, and the influence to make a difference in their lives and the lives of others. In March, we also have Cerebral Palsy Awareness Month, Trisomy Awareness Month, and Traumatic Brain Injury Awareness Month. So this past Monday was World Down Syndrome Day. It was on the 21st, and today, the 25th, is National Cerebral Palsy Awareness Day. So again, this month has provided us with an opportunity to celebrate the talents and the strengths of people with IDD and to ensure that their unique gifts are represented, acknowledged, and affirmed. The proclamation further is on our website under What's New at DDA section and also on our Facebook page. Other organizations have picked up on our social posts, excuse me, and shared them to promote it with their own readers. And we thank you for that. We've also created a series on our Facebook in honor of DD Awareness Month that highlights 6 focus areas and gives links to the corresponding pages on our website. And if you haven't been on our DD Facebook, please consider doing so, and you can find the link on this slide. Next slide, please. So Appendix K basically started obviously with the beginning of the pandemic when the CMS gave states guidance, and it gave us a lot of flexibility. And on March 14th, the Department of Health Secretary Dennis Schrader confirmed that all Appendix K flexibilities that was supposed to end on March 31st, 2022 will now be extended to June 30th, 2022. Okay, extended to the end of the fiscal year. That means that individuals, families, and providers can continue to use the flexibilities that you've been using when you plan your transition back into services after we get back to whatever the quote unquote the new normal looks like. Specific to meaningful day services, billing and PCIS2, the department will propose new emergency regulations from April 1 to June 30th, which will increase the provider requirement billings at a minimum that were in Appendix K from 1 hour to a 3-hour billing per day. So you were billing for 1 hour and being paid for the day, and we've had a lot of conversations about providers coming back on, they're getting staffing, and what does this look like? And so again, we're looking from April, next Friday, April 1, until June 30th to start billing 3 hours a day to get paid for a full day. And so while this extension provides more time to use the flexibility, we need to plan for transition, and it's extremely important to continue to have these discussions and with your support teams, etc. The case management providers can help understand such things as scheduling, needing staff training, completing new self-directed forms for families that you may want to hire and continue to employ ongoing. And if you have any questions, please contact your DDA local regional offices throughout the 4 parts of the state. Next slide, please. So, as you know, for the past 6 years, many of you have participated with DDA and NASD, the State DD Directors Association, and Human Service Research Institute, HSRI, which has participated in a multi-state collaboration for DD agencies. And this is known, as you see on the slide, as the National Core Indicators. And we're basically looking at what the state, how well is the state doing, and individual providers are doing, and families are doing with a staff stability survey. This whole initiative basically was launched back in 1997 with 13 states. And now there's 45 states, including the district next to us, District of Columbia, that participate in this, that gives us good information about where we are with workforce changes, provides insight into potential improvement opportunities as we continue to move forward as a state and as DD administration. So the goal of the staff stability is to assist us in responding. Us is all of us, not just the DD state portion. It's the providers, families, individuals, etc. That makes a direct impact on the cost and the quality of outcome as a result of staff turnover. And we hear about staff turnover from the providers and their agencies. So it's not just the ability to recruit, it's the staff turnover issues. And the survey helps us to develop policies and initiatives to support the recruitment and retention of our really important and vital direct support professional workforce. And let me just say that, as you know, that those of you who have completed in the past, that the survey is anonymous and your information is entered directly into the NCI HRSI portal. It does not come through a DDA at all. And so we encourage all of you to please complete the survey by June 30th. And if you have any questions, please contact Leslie Suziak, who's our Director of Provider Relations, and you can see her email on this slide. Next slide, please. So now let's talk a little bit about the advancement in our DDA 6 focus areas. Next slide. So, as I said earlier, each of our DDA Directors has exciting developments to share with you today. We've organized the updates around our 6 central focus areas. We used to have 5. We added assistive technology because what we've learned to move forward with the pandemic and the Appendix K and the flexibilities around assistive technology has told us that, well, people have told us that they don't want to go back. They want to stay with their assistive technology interventions that they're using, etc. So as we here at DDA try to keep these 6 goals in the forefront of our daily work, we want to make sure that it's meaningful services to our whole DD community. And that's why we call them focus areas, but we think of them more as rights that we strive to uphold, about self-determination, that all people have the ability to direct their own services and have their own lives, that we want self-advocacy. And we know that we've done self-advocates. We know that we've have people on to go do some training on Project STIR, Steps Towards Independence and Responsibility, which is a curriculum around having people having their rights, to have their voice heard, and to make sure that the resources are in place to do that, and make sure that people can have their own vision and be able to have not just self-determine, but advocate on their own behalf and not rely on other folks. And so family support has been extremely important. Many of you know Mary Ann Kane-Brushy and the work that she's been doing, and the support that we've got in the collaboration we've had from other areas in the state departments like MSDE, et cetera, in dealing with the family coordinators, et cetera. So we want to be able to keep families connected, et cetera. Housing is important. We know that people need the right to have accessible and affordable housing. We've been an employment first state for a long time, and people have the right to work. Not that they have to work, but they have the ability to be offered the right to work and to receive a competitive wage that's integrated as an employment opportunity. And lastly, as I started to say, we learned a lot during the pandemic from people who are actually wanting the right to have equal access to information and services, et cetera. And every effort should be made in the way of devices, software, equipment, et cetera, so that people can perform activities and to live independently. And we've heard a lot of those stories from individuals and families about, I never thought of my relative would be that independent as they have been, et cetera. And we learned a lot during the pandemic, and we learned a lot through assistive technology. So with that, I'll stop and I'll turn this over to Rhonda Workman, and thank you.
Thank you, Bernie. Next slide, please. So I'm excited to start the first focus area as self-direction. And the DDA supports participants' rights to self-determination and choice to self-direct their services. And as noted here, self-determination means making your own choices, learning to effectively solve problems, and taking control and responsibilities of one's life. Our self-directed service delivery model continues to expand, and now we're closely approaching about 1,900 participants using the self-directed service delivery model. Next slide, please. So to share a couple updates with you related to self-directed services, the department issued a memo on March 4th related to personal supports, overnight supports, and this was a policy update. This slide includes a link to the policy memo that was issued. And in the memo, it notes effective March 1st, the provision of awake overnight supports is a component of our personal supports when used under the community pathways, community supports, or family supports waiver. The provision of overnight supports is available under both the traditional model and the self-directed model. Waiver participants' assessed needs must be demonstrated such that there is a behavioral or medical risk that requires awake overnight supports, and that this information be included in the person's person-centered plan and documented in an approved nursing care plan and/or a behavior plan. The DDA also updated the personal supports policy, which is noted in our policy stat. We've also included a link directly to that policy in the second bullet here for you. In this policy, you'll see that it notes overnight supports should be documented in the person-centered plan risk section as one of the mitigation efforts in addressing the applicable behavioral or medical risk. So coordinators of community services will be indicating that within the risk section of the PCP. In terms of some of our participants that are self-directing and have overnight supports already in their plans, the regional office self-directed lead staff are working with the coordinators of community services to facilitate the revised person-centered plans to update the previously authorized DDA state-funded overnight supports to be waiver services. The DDA is also exploring updates to the self-directed budget sheet related to the personal supports line item to reflect personal supports, awake overnight supports, to help indicate that in the budget sheet if authorized. Next slide, please. On Tuesday, March 22nd of this week, we issued guidance related to self-direction for people and in terms of the April rate changes. We've included a link to the guidance here on the slide for you. In the guidance, we provided 3 scenarios and noted whether the action was needed based on the status of the person-centered plan. You'll see in the guidance for scenario number 1 is for participants with an approved person-centered plan and self-directed budget prior to April 1, 2022, that they do not need to take any action. The approved plan and budget will continue to be used with the rates that are existing today before April 1st until a new PCP is created and approved. For scenario number 2, this relates to applicants and participants working with their teams on PCPs or person-centered plans created in LTSS before April 1st, but not yet approved. In these scenarios, the CCS will need to document the pre-April 1st, 2022 detailed service authorization proposed budget allocation before April 1st. The guidance provides specific instructions and strategies to capture that information. In scenario number 3, this relates to person-centered plans, self-directed budget allocations, and self-directed budgets created in the LTSS DDA module on April 1st or later. For all of these plans, they will be using the April 1st rates. If you have any questions related to this guidance, as noted in the guidance, you can reach out to the regional office self-directed service lead staff associated with your regions, and they are noted on the last page of the guidance. Next slide, please. On this slide, for people interested in exploring self-direction and our current participants utilizing the self-directed service delivery model, we included links to various resources, including a self-directed handbook, guidance, forms, and webinars. We will be converting some additional information and forms in Spanish and other language upon request. And as a reminder related to budget modifications, as noted under Appendix K, as Bernie has said, has been extended to the end of June 30th, participants may move funding across approved budget service lines as long as they remain within their total approved budget amount. This includes changes within current service authorized by DDA and changes from current services authorized to a new service covered by the program in which the participant is enrolled. It's important to note in our guidance that's available on our website that the participant, along with their team, will need to complete the designated Form 5 that is associated on the Appendix K page. It is important to work as a team to address unmet needs and prevent potential conflicts of interest. During the next revised or annual plan, teams should review those services that were added or moved to consider updates to the person-centered plan. Next slide, please.
Thanks, Rhonda. That was great. That leads you right into what Bernie, you were talking about. As you know, as DDA, you heard from our Deputy Secretary Bernie states that we really want to provide knowledge, opportunity, and information for people we support so that they are empowered and self-advocate for their services and needs. The DDA self-advocacy focus area promotes speaking up for yourself and the things that are important to you. We want people to be able to ask for what they need, what they want, and tell others about their thoughts and feelings. We also promote speaking out for your rights and be able to make choices and decisions. So, you know, we've actually put together information that is visually easy to understand for folks, and so we want to continue to promote that. I would also like to remind you all that the DDA has for advocacy specialists in each of the regions you heard Bernie talked about, and the advocacy specialist can assist the peer-to-peer, assist other individuals in their services, people who are not known to us, how to apply for our services. So, you know, those are the kinds of things. Talk about, you know, our traditional services or direct self-directed services, also be able to engage with families. So we want to make sure that we really are promoting and really emphasizing our self-advocacy. Next slide. I also want to share some great news. I'm excited to introduce to you our new Southern Maryland Regional Office Advocate Specialist, Patricia Hall Porter, who joined the SMRO team on March 16. She comes with 30 years of experience advocating for children and young adults with physical and intellectual disabilities. Patricia began her advocacy journey in her early 20s when she was told that she was not able to learn. She fought to get her hearing aids that were preventing her from hearing, sought out resources to get jobs, as well as attend college. Since that time now, Patricia has voluntarily advocated for hundreds of families, individuals to get resources, goods, and supports needed to help them have a meaningful and fulfilling life. Patricia has been recognized for her hard work and effort with following awards: the James E. Duckworth Award, Making a Difference Life for Individuals with Special Healthcare Needs, and Prince George's County's Chapter 263 of the Council on Exceptional Children plaque and award. During Patricia's spare time, she enjoys spending time with her 3 children, which 2 are adopted children with intellectual and developmental disabilities, and her grandchild. So I just wanted you to see it. If you have the opportunity, I put her email here so that you can also, you know, welcome her to the DDA. And so please, we're very happy to have her. We've also wanted to tell you that we've updated the advocacy specialist at a glance, and the link is on the slide. Next slide. This slide just gives you, again, contact information of each of the self-advocacy specialists. We have Cody in the Eastern Shore, Jessica Stein in the Western, Cheryl in Central, and now Patricia in Southern. So this is the list of their contact numbers. Please know that you see Patricia has her work cell number and her email. Office number we don't have yet, but we'll update this as well. Next slide. My other exciting thing to share, as you heard Bernie talked about Marianne Kim-Brushy as our family support director. Our supporting families focus area is a great opportunity to engage with our families and to create practices and provide services that promote and maximize the capacity, strength, and the unique abilities of families to support their family members. I think that through COVID and through the years, families have been resilient. They've been very supportive. They've voiced to us their needs and how we can enhance their system. And I think that having this as a focus area is critical in how we connect with families. How do we do peer-to-peer support? how to engage, how to increase our communication, and also how do we communicate and navigate through our communities of practice supporting families turning the life course. We're doing a lot of webinars. We've done an ongoing communication. We try to engage and get polls from you as to what's working, what's not working, and what kind of webinars you want to see. So you'll see that we're tailoring our webinars and support based on what you tell us when we're doing a good job or where we can enhance or create a better platform for our educational webinars to families. So please stay tuned. Our goal is to create a supporting families DDA landing page. And so that's coming up. Hopefully by the next webinar, you'll get to see our new landing page and all the resources and information we have to offer. The next slide has some really good information that I am so proud of Maryland and of Mary Ann Keynes-Brushy leadership. The DDA has partnered with families, advocates, and providers to create the webinars that we just shared with you, just told you about. But we also are doing some really good series. And this is from families. This is what we heard from you. So we want you to save the date. March 30th, we have a webinar for families and advocates, and it's called Your CCS, Building Successful Relationships. And so we heard from families saying, you know, sometimes we don't even know how to use our CCS when we first come into this DDA services. So we really are going to have a conversation engaged from the family's perspective, from the CCS perspective, from the person's perspective of what does it really look like? What are the resources? How do we maximize our CCSs and how do we use them as a resource? So please join us on that. The link is there for you to register if you're interested. We also have on April 27th at noon, a webinar on self-direction, living your best life. And we're partnering with some folks from the Self-Directed Advocacy Network and other families to really create, what does it look, what should families know? What should we know about self-direction and how do we make it happen in the state of Maryland? You heard Rhonda talked about, you know, we have over 1,900 people now in self-direction. So you can see that we have a trend that people are choosing that option for their lives. Next slide. This next slide is kind of like the who's who in the communities of practice. You know, Maryland has been engaged in community of practice for the last 6 years, and the DDA and members of the Maryland Community of Practice Supporting Families will be attending the annual national conference, which is on April 12th. And each year, the National Community of Practice for Supporting Families hosts a gathering of national partners and members states to share learnings between the community of practice states and as a full community of practice to both. They celebrate, highlight the work of the states over the past years, ensure states can hear concrete information, updates, and ideas from other states to take that back to our own state to really enhance and create a really robust communities of practice, identify potential next steps, and also collectively partner in support of the whole supporting families movement. So it's really very powerful, and we really are prepared to really look at how does DDA in Maryland really looks ahead. So during those conferences, we get to hear them, we get to then prepare, and then we get to engage in specific focused conversations around actionable strategies and weave those into the principles of supporting families, you know, or both grassroots and systems work from our priorities that we have at DDA. We discuss state ideas and priorities at the national level and at the local level. So those are really great opportunities that we're engaged in, so that we really are tapping as to what are families saying, and then how can we support families. And members will also attend the Turning the Life Course Showcase, which will be a time to exchange knowledge, build capacity, and engage collaboration with advocates, families, and leaders across the nation and also in Maryland. So if you have not heard about a communities of practice, if you want to be involved in the community of practice, if you want to know more about it or share within your own, you know, lunch and learns or your own groups that you have with families within your entities, within your circle of supports, you know, please reach out to Mary Ann Keynes-Brushy. Her email is on the slide. Next slide. This section that we're talking about is another wonderful focus area, is our independent living. and it's really our independent living in housing. And really, we want to be able to support people in supported living in their own homes. We want to focus to ensure that people can be supported to choose who and where they want to live, provide the opportunities to use and learn skills, just like you and I, where we live, and share our community, and to have the opportunity to make decisions that affects the person's life, to be able to be home ownership or to rent. And so those are things that are really critical and important. And so with that, I'd like to go to the next slide and give you some really, really cool updates. And I get very excited because it's under my preview, and the folks are really very passionate about what they're doing. But, you know, it is really a great pleasure to let you guys know that this year, the National Association of State Directors of Developmental Disabilities Services, NASD's mid-year conference, will focus on the importance of collaboration with community partners. That means, how is DDAs partnering with you guys, with providers, with families, with advocates? And so that's the theme this year. And our Deputy Secretary, Bernard Simons, along with Tim Wings, the Director of the Maryland Inclusive Housing, will present a Maryland expansion of housing opportunities for individuals with intellectual and developmental disabilities. So if you have been following us in the last year, you would see that we have promoting, we're partnering, and we're really creating housing opportunities, not only through our housing support services, but through independent living, shared living. There's lots of things that we really want to promote so people can have the choice of living where they want to live and with whom they want to live. So I'm excited about this conference. It's on June 16th and 17th in Alexandria, Virginia. I think it's going to be a virtual platform and also in person. So we'll be posting some of this information in our Facebook, so you can follow us. But if not, you can also follow the NASD's Facebook, which they'll be announcing more details about the conference. We're also very excited to announce that the DDA has a new rent subsidy program, a tenant-based subsidy program similar to the Housing Choice Voucher program that we've had in Maryland for years. And that provides rental subsidies to individuals with developmental disabilities who choose to live independently. And so we have partnered with the Department of Disability, and we'll be providing trainings across the state in the coming months. So the next slide has just like a glance view. We have trainings all the way until, I think, June, but these are the ones that are in April. And so here it tells you April 7th is really for families, providers, and people who are receiving services and want to know more about the housing support services. And so if you click that link, you can register. On April 11th, we'll introduce the rent subsidy program to coordinate to the Coordinator of Community Services and House Support Specialists agencies to provide guidance on how to work together to assist individuals obtain and maintain housing. And so if you want to know about this program, that would be a good one to register. Our goal is really to kick off this on May 1st. So really, we're setting up the stage so that everybody gets information prior to the kickoff. Our kickoff is May 1st, but we're doing a lot of prepping and educational sessions between March, April, and so kickoff would be May 1st. The 29th will be for families and people in services and information about the rent subsidy program. So these are just some resources of the good things that you guys are doing with us and that we're partnering. And so try to join this webinars. We had some really great speakers, and Diane Dressler is actually the presenter with our Director of Innovations, Stephanie Jones. And so that would be a good opportunity for you guys to join. The next slide of course, everyone here in Maryland knows that we're an Employment First State. And because we're an Employment First State, we are focusing on using each person's strengths, interests, and skills to support competitive integrated employment opportunities. Our goal is to support providers to expand capacity to support people to obtain and succeed in competitive integrated employment. And I'm happy to report that we are also started the CCS Employment Training Series. And it's a series that was created by Community Inclusion University of Mass Boston. The series is titled Improving Employment Outcomes for Individuals with Intellectual Disabilities, a comprehensive course for our CCSs in partnership with the Institute. And so what it is a self-paced training that CCSs can take and then get really knowledgeable and grounded on the employment path. And we have 32 CCSs that have enrolled and 13 that have completed the course. So it's been really nice to know that that has happened and it continues to take place. And so our goal is that the more education, training that we give people who are supporting or having the discussion with the teams and the person about employment, that they have the resources on how to properly guide the person and provide those additional resources. Next slide. This next slide is really to take further on employment initiative. It's really to support an employment focus that we have at DDA, because we are committed to full implementation of our LTSS DD module, Maryland, and also to expand the opportunities to really start looking at more community engagement. And how do we do this coming out of a pandemic? How do we then go from 1 to 3 to full day? You know, how do we go about doing this? And so we partner with the Institute for Community Inclusion out of US Boston, and they've been providing technical assistance in Maryland for this cohort now for the last 4.5 years. And so we do a educational webinar, we do applications, and so we wanted to really highlight the opportunity that we're offering our providers to engage in this wonderful technical assistance project. Our vision and our goal is to support providers to expand capacity, to support people to obtain and succeed in competitive integrated employment. And you know, I always want to also share, why are we doing this? Why are we getting so? Because to us, it's an investment. This is really, and to assist to provide the providers with expanding their capacity to support people to obtain and succeed in the whole competitive employment. And you have to start within your organization, within your leadership, within your teams. And so we figure that we find that this training and technical assistance project does provide that hand holding, that resources that people may need to really start thinking of a very different business model. Next slide. So this cohort in this technical assistant has two parts. The first is the technical assistant that supports organizational development. It has 13 months. It includes strategies, assessment, and planning process. It engages with key stakeholders, development on an action plan, and ongoing technical assistance. You'll have a chance to share experiences and strategies and explore specific priority topics as a group and in the learning community. And the second part is the whole leadership and management training. So this slide tells you a little overview. And if we go to the next slide, it really talks about that whole leadership and management training. Who actually should participate, and what does it mean, and what is the commitment? We really want mid-level manager, emerging leaders in the empowerment of this whole meaningful day supports, and up to 3 staff from each participant provider. And then we offer online training and lessons, and we meet on a regular basis. There's opportunity for Zooms and discussions. And so we really want to make sure that, you know, one of our priorities is to support the development of emerging leaders. So we really want to make sure that this is out there for you guys to take advantage of. And then the next slide just kind of tells you about who should apply. And we're saying any DDA employment service provider in the state of Maryland is eligible to apply. If you're looking at creating a different business model, if you're looking at how do you transition into the fee-for-service, this is a great opportunity because it can walk with you, guide you, handhold you, provide all the supports that you need. And then also organizations with a commitment to shifting their focus from a center-based supports to competitive integrated employment. So if you apply for cohort 1, you can apply again, but there'll be opportunity to engage as a full group later in the session. The next slide just kind of gives you, okay, if you're interested, well, where do I go? How do I apply? We put the link here on this slide. If you just click on there, it brings you to the application. We have actually extended it. The application is due April 14th. And so in order, once you complete the application, you need to include a signed letter of commitment from both the CEO and your board of directors to engage in this wonderful opportunity. And then the next slide gives you who to contact. Where do I need to go? If I have more questions about this, do I contact Patricia? No, you contact Stephanie Jones or Cecile or John Butterworth, and they're here on the slide. The other piece too, if you want to know more about the actual technical assistance and what does it mean and the goals and the objectives, we have a pre-recorded webinar that you can click on that link and it'll walk you through everything that you should expect from the technical assistance from this project. So I hope that some of you who are meaningful day providers and looking at different business model, expanding your services and offering employment will take advantage of this wonderful opportunity. Next slide. This one I love everything that I do at DDA, especially with the focus areas. This one is our assistive technology. You heard Bernie talk a little bit at the beginning about adding the 6 focus areas. And we really, this is to really, our goal is to become a Maryland technology first state, as you heard that. And it's not just DDA, but it's our partners, it's DOORS, it's Developmental Disabilities, it's all of us together. And so we've engaged with families, with providers, with other entities to really help us carry this through. And so we want to provide support and assistance to people to increase independence, overcome challenges, and become more connected to their communities. And we want to increase awareness of what is available in resources in our state. We have great resources. We also want to increase access. So work with the partners to ensure Marylanders have access to the most recent technology and access to funding and or resources to obtain the technology they need to engage into the community, to do things that they want to do. We also want to increase autonomy. That is so critical. You know, you heard Rhonda talk about self-determination, about those things are so critical and important. We want to increase the need for traditional services in many limited when they're stuck and they don't have the resources. So we want to make sure that people have the access to their community, and the more resources and more knowledge, and the people can then be empowered and be able to self-determine their lives. The next slide is, I just wanted to just say, in your right-hand corner is the logo that the Maryland Technology First created. So I always bring it up because that's going to be the new logo. You'll see this as we're talking about this. We actually wanted to share with you, and I think I shared this before, to save the date. We really are going to be doing our kickoff. Our kickoff is going to be August 15th. And so the DDA has partnered with sub-advocates and families, and our goal is to do the kickoff. And the Technology First Committee will announce and declare Maryland's becoming a technology first state, in which the Marylanders with disabilities will be empowered. We're also having the governor do a proclamation. So we're very excited about this kickoff. If you want to know more about this, if you want to be engaged in our group, in our stakeholders group, please contact Stephanie Jones. Her email contact information is on the slide there. Again, I'm just really grateful and honored that the DDA has the 6 focus areas, because it's our guiding principles and our goals about people's rights, and then our trajectory of what we want to do. Because it's not just about, you know, the funding piece, but it's also about the quality and what it means to really look at people's trajectory and what they want to achieve in their life. So I'm now going to turn this over to talk about the operational piece of the DDA. I'm going to turn this over to Robert.
Thank you, Patricia. And that was a lot of great information that both you and Rhonda provided. I actually learned a few things today as well. So good afternoon, everyone. For those of you who do not know me, my name is Robert White, and I am the Director of Administrative Services for the DDA. Current LTSSMaryland fee-for-service rates that have an effective date of November 1, 2021 have been updated and posted to the DDA website and will be effective April 1 of 2022. Keep in mind that these rates do not apply to services being billed in PCIS 2. The Maryland Department of Health, as well as DDA, remains appreciative to the many stakeholders who have contributed to these updates. which have also been informed by the DDA provider fiscal impact tools, or the FIAT as we've come to know it by, the LTSSMaryland Early Adopter Group, and the leadership of the Maryland Association of Community Services. So moving forward, all rates will be reviewed annually using a Medicaid rate review structure incorporating the DDA Rate Review Advisory Group. And there's more information on our website provided at the link below at the bottom of the slide. Some of the notable changes were updates in community living group home rates to reflect the smoothing of the residential hours and adding additional shared hours to promote individual support needs. As far as community development services, we increased the rate there to support community integration. For meaningful day services, we were able to increase the funding rate. And then personal supports and personal supports enhanced, there was an increase for the rest of the state for those rates. We have received numerous inquiries from stakeholders regarding guidance and clarification of base hours, flex hours, and shared hours, and the relationship to dedicated supports. And so I just want you all to know that, we remain committed to creating a flexible system, and we will be providing updated guidance and clarity early next week. Next slide. Okay, so the DDA recognizes, and we certainly appreciate the strong interest of providers in planning their billing transitions to the LTSSMaryland fee-for-service system. The regional directors have been working individually with providers to ensure that PCPs are reviewed ahead of the transition, as well as ensuring that each agency has all of the other billing requirements in place for their successful transition. And as you can see, we have 22 providers who remain committed to being part of the 2A pilot this spring. In partnership with our early adopters, the DDA was pleased with the tremendous interest and participation in 2 of our recent PCP and waiver service trainings. The feedback and the great questions from attendees were appreciated and are being incorporated into guidance, as well as our frequently asked questions. Those webinars are available on our website for anyone who is interested. And if you have any issues trying to locate those, just let us know and we can send you the link directly. We are also working with partnering providers and partnering with you all on an upcoming Lunch and Learn series to continue to support topic-specific focus areas for individuals and families, providers, and CCS agencies. So please let us know if you have any training interest. Now I would like to turn the mic back over to Deputy Secretary Simons, who will talk about COVID-19 response and resources.
Okay, next slide, please. And thank you, Robert, Patricia, and Rhonda for your presentation. So as you can see here, here is our booster numbers by region, and it's been an increase of about 1,400 since the last webinar in January. And please remember that your local health department remains a key partner for testing and PPE, as they have supplies and can be offering free N95 and KN95 masks and home test kits, etc. So again, don't be shy, contact your local health department using the link on this slide. And again, we're at an increase of 1,400 since the last webinar that we had. And I think that this is good progress, but we need to not keep our eye on the ball and keep seeing if we can increase these booster numbers, knowing that, as we watch the news and hear about, even though Maryland's doing great with our numbers, you never know. I mean, everybody never expected Omicron or any of the other variants that were coming around. So we need to keep our diligence and make sure everybody is safe, and still wear your mask if you wish. Obviously, it's not mandated. There's been a lot of jurisdictions that have lifted it. And also, wash your hands is good, just basic hygiene practice. Next slide, please. Please remember that the regional offices remain your partner. And don't hesitate to reach out to them for any guidance, assistance, whatever you need to feel like you need to talk about. We want to keep sure that we have a strong relationship with individuals, families, providers, people who are self-directing, everybody, direct support professionals, etc. So again, make sure that you are utilizing your regional office as a resource to move forward with what you're doing and what's on your mind. Next slide, please. So this slide, if you could share with your colleagues, basically is the upcoming webinars for families, participants. If you could share with everybody. As I said in my opening remarks, we get a lot of positive feedback, even though we are not pivoting on, we pivoted away from the main emphasis that we did on the pandemic and COVID-19. But, obviously, as we continue to see, as I just said, the numbers coming down and how well the state's doing in getting beyond the pandemic, et cetera, that, we need to think about other opportunities that people have, as we talked about our 6 focus areas and all of the items that we learned during the pandemic, especially around assistive technology, et cetera. So with that, I really want to thank everybody. Please register for one or all of our upcoming webinars, and you will receive a confirmation email. And again, I want to thank everybody for attending today's webinar, and I'm sure we've got questions in the posted in the question box. And as always, I value your feedback and what you're telling us, and recommendations that you're giving us about DDA and where we need to go and how we need to assist individuals so that they can have a more better and productive life and participate in their community. So with that, I think we'll turn this over to whoever's moderating the questions.
Thanks, Bernie. Appreciate that. So I'm going to read a couple of questions. I think we have about 7 minutes or so to go through some of. There's lots of questions on the question box, but please know that we will take all the questions and we will answer them and make sure that we post them on our website. So just because we don't read them here doesn't mean that we are not addressing. You heard Bernie say your questions are very important to us. We value what you have to share and say to us. And so we will definitely make sure that we will address them and then post them on our website. So here is a question. Rhonda, for you. When will more information about overnight supports as part of personal supports be available? And when will the update budget sheet will be available?
Yeah, thank you, Patricia, and for the person that shared that question. As we shared today, some information that was previously sent out. So you've got the actual memo that came from the deputy secretaries announcing the update to the policy. We have already updated the policy related to personal supports and noted, as I mentioned today, the guidance for CCS is to note overnight supports in the risk section. So in terms of personal supports or any service, that person-centered planning process would occur, discussions about participants' unmet needs, and if it's determined that overnight supports are needed because of a medical behavioral risk, as noted in the behavior plan or nursing care plan, then that would be submitted similar to any other personal supports and noted within the person-centered plan. And as I mentioned, the CCS would also note that as a risk in the risk section and noting that overnight supports would be the mitigation strategy. In terms of the self-directed budget sheet, we had conversations recently with the fiscal management service providers who made that suggestion. So we are taking that back and looking at that with any other considerations for updates to the budget sheet. and then we would reissue that. We need to make sure that it continues to have, those fields that would automatically calculate cost and be dynamic. So we'll be working on that and issuing it as soon as we can.
Great, Rhonda. So to follow up to that, are the LTSSMaryland rates effective on April 1st of 22 also for self-directed participants, or will there be guidance for self-direction?
Yep, and that's another really good question. We have taken a look at the April rates. The April rates have some increases to some services, and it also has some decreases to some services. And so as we noted within our current guidance that we shared the links on the presentation today, that we are going to continue to use the existing reasonable and customary standards for both wages and vendor provider rates until the cost of living, or the COLA, goes into play, which is proposed to be effective July 1st, 2022. In some conversations with the Self-Directed Advocacy Network and internally, we didn't want to issue updated guidance or reasonable customary standards where some rates would be decreased or wages decreased, and then turn around and increase them with a 4% increase. Therefore, we're going to use the existing ones until July, when we'll issue the updated one.
Thanks, Rhonda. Really appreciate it. I do, I know it's close to the time, but I'm going to ask 2 more questions. I do want to acknowledge that there's a lot of questions in the chat box about the residential service base hours and dedicated hours, and Robert did share in his presentation that further guidance was going to come out, and our goal is to try to get that out to you guys mid next week. So I just don't think that we're not calling you, we're ignoring you. We just put the questions in the chat box because we're going to go through each and every one of those. Robert, there is several questions in the chat box about the ARPA grants and the grants. Do you have any update on that?
Yes, excuse me, what I can share with folks today is that we are working on a communication related to the ARPA grants, and that communication will go out early next week.
Thank you. And there's another question here. Is the training on 3:30 will be conducted on that day or in the future in Spanish, or for those families who are underserved due to the language barriers? What we're going to do is I'm going to ask Donna to, as we put training information out, ask for specific accommodations. So that way we know what kind of accommodations, and we can be prepared to make sure we either have interpreters or we have the information in whatever language we need to do. So that's one of the things we're just going to start doing is when people register, we're going to ask for specific accommodations, whether it's specific language, and how we can get that information out. And then there's another question, and I probably need additional information, but it's, can a provider help the individual pay their rent in supported living? Again, I need more information, because is it a contract between the person and the provider, or is it just you're helping them? And then you may want to learn a little more about our rent subsidy program that we're launching, because it may provide you some resources for that. And then there's several questions in here, and it's 2 o'clock now. So we're going to pull all of these questions because they're really good questions about rates and guidance. And so we're going to populate those and get back to you. So Bernie, I'm going to throw it back to you.
Yeah, so your questions are important, and we will populate that in a document and provide answers to the questions that we didn't get to today. So again, I want to thank everybody who's on this. We had great attendance. Everybody who's on this webinar, and have a safe and hopefully quiet weekend. And thank you.